Naba, welcome to the program. Thank you for joining us. Naba, what more can you tell us about the cholera and dengue outbreak in Sudan?
Actually, cholera and dengue outbreak in Sudan right now is a very big threat to the country that is already overwhelmed by the war and the collapse of the healthcare system with the bombing of hospitals, and doctors are fleeing the country, and the government is prioritizing the expenses on war. Of course, the health system is overwhelmed and people are suffering from the lack of medicine, from the lack of doctors, and from the bad conditions. There is 1,600 cases of cholera were recorded in 22 localities in Al-Gedaref state, Khartoum state, South Kordofan, and other Sudanese states, including 67 deaths. Regarding the dengue fever, there is at least 49 deaths among 3,000 suspected cases, and Al-Gedaref only, which borders Ethiopia, recorded 33 deaths from 2,150 cases. So yes, the threat is really big, and even before the war, Sudan was struggling to contain these diseases as it's associated with the rainy season, and now with the bombing of hospitals and the overwhelmed health system, we are expecting very bad situation and a worse situation. Despite that, humanitarian organizations are doing their best and scaling up the response to contain this disease, but the threat is bigger than it's expected. So yes, cholera and dengue fever are a real threat, especially during the war, and there is 3 million Sudanese people are vulnerable and at risk to these outbreaks.